Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise, and I'll be talking to you today for this episode. Now, if you're watching us live, we come to you every Saturday at 10:30 a.m. over YouTube and Facebook. YouTube's our main place. Be sure to hit that subscribe button. If this is your first time visiting with us, be sure to go to our UroPatient.com website where you can find out everything you need to know about the show and also find all of our past episodes. More importantly, we do create downloads of helpful information on every topic that we've addressed. So be sure to check that out to go ahead and download your free copy of any of our patient instructions that you'd like. This episode is going to be on TUR, the prostate, transurethral resection of the prostate, sometimes called Roto-Rooter. Everything you need to know about it. And we're really fortunate to have Dr. John Lynn joining us. He's a friend of mine. This is a urologist out of Gilbert, Arizona. And he's going to give us a brief talk about how he does the case, how he does the procedure, and we'll even do a little video footage of the procedure itself. And then take and discuss it a little bit more afterwards. So let's go ahead and let's bring John Lynn in right now.
I'm going to talk about a procedure that I perform a lot of. It's called TURP, also known as transurethral resection of the prostate, commonly known as Roto-Rooter. Now, this is a procedure that is used for the treatment of guys with enlarged prostates and they have a lot of trouble urinating. So I'm going to go over some of the frequently asked questions and some of the misconceptions that the public has regarding this procedure. Now, so for those of you who don't know me, my name is John Lynn. I'm a urologist in Gilbert, Arizona, and I work at Sunrise Urology. TURP is a procedure that is covered by Medicare. So rest assured, when your urologist talks to you about TURP, it is covered by Medicare. Another common misconception of TURP is that after we perform a TURP procedure, the patient stayed in the hospital multiple nights. So in the past, patients would have to stay overnight in the hospital, and that was how I was trained. However, because I've done so many of them, and I'm really meticulous when it comes to making sure that the bleeding is completely stopped before the patient's out of the operating room, I can't remember the last time I had to keep a patient overnight. Almost all of my TURP patients go home the same day that they undergo the procedure. Another question guys typically ask me, well, do you do it here in the office? And the answer is no. The procedure is done in the operating room, meaning under anesthesia, typically under general anesthesia, meaning you're completely knocked out. Here's another thing guys are very apprehensive of. That catheter, that tube draining your bladder, that tube is inserted under anesthesia while you're asleep in the operating room. So you're not going to experience somebody putting a catheter in. When we take it out in the office, you will feel that, but the discomfort is minimal because the surgery is done in the operating room and you are completely put to sleep. That means somebody will have to drive you home and kind of watch you after the surgery. And again, you go home the same day as the surgery. Now, you may be wondering, how long does this procedure take to perform in the operating room? Typically, 1 to 2 hours. And that is not really the time it takes for me to physically do the procedure. But keep in mind, when you go to the operating room, it's a big ordeal. It's a big orchestrated ordeal involving multiple people. You are admitted to the surgery center. Nurses check you. They start an IV on you. They make sure you understand the procedure. They have you sign paperwork. We make sure everything's, all the ducks in the row. And then we transport you to the operating room. Now, that's when I start the clock, 1 to 2 hours. We then have to transfer you to the operating table, put you to sleep under anesthesia. Once you are asleep, then we position you, and then we drape you, cover you up in sterile draping, and then the procedure is done. So that is when I come into play, when I actually do the procedure. So it takes a while to get you on the operating room table before I can start the procedure. So the procedure takes about, today, half an hour, sometimes an hour and a half. It just depends on the size of the patient, the size of the prostate, and also sometimes bleeding dictates how meticulous and how much longer I have to take to perform the procedure. Question that guys ask is, how do you actually do the procedure? Do you cut on my skin, or where do you go in? Well, the procedure is performed using a telescope inserted through the urinary tube, so I can look at the prostate, look at the bladder, and then the procedure is done through that tiny little instrument. There are no incisions, no cutting of the skin at all. Everything is done through the urethra, through the urinary tube. All right. And it is done with a telescope, no cutting of the skin. And then guys are often worried about this tube called a catheter draining their bladders. A catheter is inserted under anesthesia. Again, you're not going to be feeling any of this stuff. You're going to be asleep. And typically, guys are worried, oh my gosh, it's going to be super uncomfortable when I have to wear the catheter or drainage tube. Typically, again, it varies by patient. Typically, the catheter stays in the patient for about 3 days. So I try to get it out as soon as possible. And that typically is 3 days, sometimes 1 day. Okay, it's just individual. I'm going to tailor it to your prostate. Guys also ask me, well, how long does it take for me to recover from this procedure? And the general answer is it may take several weeks or longer, depending on the patient. It is highly individual. And also, what is full recovery, right? Full recovery meaning you're going to have a strong stream and feeling like you're emptying your bladder right away. Well, that's going to be pretty darn fast, typically. But if you're talking about, remember I talked about irritative voiding symptoms, feeling like you got to go frequently. When you have the urge, you have to run to the bathroom, urgency, and getting up at night multiple times to urinate, called nocturia. Those symptoms, again, may take several months to improve or resolve because a lot of it's behavioral. Although very rare, this procedure may affect your sexual function, including erectile dysfunction, okay? But because of the newer technologies that I use, the energy spread from the anode to the cathode is millimeters away. It is so close. So the thing that we worry about is when you're using monopolar in the old days is that the energy from the loop is transferred to a grounding pad somewhere else on a patient. So sometimes that distance is theorized that the travel of the electricity may affect nerves, including erection nerves. And in practicality, I have not noticed guys with erectile dysfunction after the procedure. On the contrary, interestingly, anecdotally, I have some men who have said that they had an improvement in his sexual function after TURP. In my experience, permanent urinary incontinence or urinary leakage after a TURP is extremely rare. Extremely rare. Urologists, all of us, we are extremely aware and extremely careful to make sure that there's no urinary incontinence, or we try to do everything we can to avoid urinary incontinence, causing urinary incontinence after this procedure. His worst problem was bladder spasm. It was painful for him, it was agony, and nurses would not help him with the pain. So bladder spasms are very common anytime that there's a foreign body in the bladder, including a catheter, a Foley catheter. So this tube that drains the bladder actually has a balloon inside the bladder to kind of hold it in place so it doesn't fall out. Anytime there's a balloon or any sort of foreign body like a catheter, what's your bladder's normal reaction? Your bladder wants to get rid of it. So the bladder is going like this, trying to squeeze and get that foreign body out of the bladder. And sometimes guys experience bladder spasms. Some guys experience strong bladder spasms, and some guys are like, it's no big deal. highly individual, just like recovery. How long it takes, what you experience is very individual. Something that does happen, and I tell, even though studies will quote you, X% of patients will experience what's called retrograde ejaculation, also known as dry orgasms after a TURP or roto-rooter. So typically, guys are older when they need to have a TURP, unless you have a really young wife and you're trying to get her pregnant. By the time you need a TURP, having that lack of semen output is typically not a big worry for a lot of my guys. Keep that in mind when it comes to TURP. You will have less semen or sometimes no semen coming out during ejaculation. And clinical studies have shown that at 5 years, only about 5 to 10% of men require additional treatment after undergoing a TURP. TURP, also known as roto-rooter, is an extremely durable, meaning long-lasting procedure. For a lot of my guys, if they're older, it should last him for the rest of his life after performing this procedure once. It has been called, believe it or not, the gold standard when it comes to taking care of men with enlarged prostates. Also, during recovery, because I did go through the urethra, the urinary tube, I did put in a catheter at the end of the procedure. So once that catheter comes out, the guy may experience a little burning with urination and blood in urine, including sometimes passing a few clots. Now, after the catheter comes out, after TURP, what I typically do is prescribe an antibiotic and also a medicine that turns the patient's urine orange. What that medication does is it coats the urinary tract, including the urethra, so that there will be minimal to no burning with urination. If you know some guys with urinary difficulties, have him get checked out right away. Sometimes you wait too long, your bladder becomes shot, meaning no longer has the ability to squeeze, and you end up having to wear a catheter all the time, or you end up having to put a tube in your bladder multiple times a day to empty your bladder. So don't wait that long.
Thanks, John. That was really helpful. I think you did a great job of covering all the big questions that people have, and sometimes the hesitation about going through the operation. But let's bring in a clip from the operation itself just so you can kind of see what this looks like. And you can see that's looking through the scope, and that's the cutting loop. So you see that silver metal thing. It looks like, I would say it's kind of like how you slice cheese with a wire. So it's the same way. It's scraping, but it's also hooked up to electricity, so it burns and seals all the blood vessels as it cuts through. So you can see he's taking out chip at a time, and clears out that prostate. Now, this is towards the end of the operation. As he mentioned, you can go in there and really make sure there's no bleeding, and that gets the catheter out sooner and has less complications. So that's what that looks like, nice and open. That's what we were aiming for, is a nice open prostate. And it is the gold standard, so it is the best way. So we'll talk about some patient prep stuff that he didn't talk about that I want to make sure we don't forget. You're going to have to stop blood thinners because there is some bleeding, so you don't want to have something that would make you bleed worse. It's going to be done under general anesthesia, so nothing to eat or drink, usually 8 hours before the surgery. You'll have to get pre-op testing because of anesthesia normally, so it could be blood test, cardiogram. Your doctor will decide what needs to be done. In your case, you are under anesthesia, so make sure somebody's there to drive you home. And hey, don't wear those skinny jeans. Wear comfortable clothes, because you're probably going to go home with the catheter, and it's going to be hard to put that on if you've got those kind of pants. As I mentioned, general anesthesia, you're going to be completely out for this, so you won't know what happened. And this is just mentioned, it is a rigid cystoscopy, so basically what you see there. And that's it. So if you're worried about having it done, I hope this was helpful, because there's really great results from it. It is the gold standard for a reason. And of course, there are handouts on our website, so be sure to go to UroPatient.com to look up the website handout for TUR, the prostate. Some of that prep stuff is on there. Again, how's it done? This is done outpatient in a hospital setting, so either a surgery center or a hospital. How much will it hurt? Well, I say a 0, because you're out. How long does it take? between 30 minutes to 90 minutes was kind of average, and that's usually most of the time. As Dr. Lynn spoke to, it sometimes can be longer if he has to do more work to clear it out. Your urologist does. Recovery, 2 to 3 weeks is a pretty good. I would say, most of the time, complete healing takes about 6 weeks, but you should be better in about 3 weeks. Although you'll notice the result very quickly because it's nice and open. And how well does it work? Well, it's called the gold standard for a reason. It is the best. So with that, let's just put a little tip for next week's subject. We're going to be talking to you about PSA. It's your check engine light on. So we're going to tell you why I think PSA is very similar to the check engine light. But with that, have a great weekend, everyone, and we'll see everyone next week on Euro.